People in Texas are facing a brutal heat wave, many of them without power. More than 700,000 homes and businesses in the state are still coping with outages after Hurricane Beryl made landfall earlier this week as a Category 1 storm. On Friday, the Department of Health and Human Services declared a public health emergency for the state, warning that the combination of power outages and temperatures over 100 degrees Fahrenheit leaves thousands in dangerous conditions. Right now, Houston's main utility company, CenterPoint Energy, says some customers could be without power until next week. More than a dozen Houston area hospitals say they're in a state of internal disaster as city officials work to distribute generators to in-need facilities. Well, joining me now is Dr. Owais Durrani. He's an emergency medicine physician in Houston, Texas. Good to see you again, doctor. So just to start, how dire is the situation you're seeing right now in your hospital?
Yeah, I appreciate you having me. Look, I worked through COVID, and I'll be honest, the last few days have been some of the worst and kind of up there with as bad as COVID was. I'll tell you kind of a common story that circulated around Houston. A few days ago, a police officer got shot, was taken to a local hospital, and had to be treated in the hallway. And that kind of tells you everything you need to know. Currently, I worked a shift yesterday. Every room in the ER is filled. Every hallway has stretcher from end to end that is filled. When an ambulance comes, normally they unload a patient. It takes about 10 or 15 minutes. It's taking hours because there's simply no room for the patients to be unloaded to. And day before yesterday, only 4% of the ambulances in the entire city were available for a call. So that means if I call 911 and had an emergency, that ambulance would be delayed because of how tied up they were at the hospitals. When I want to admit a patient, they stay in the ER. There's no room upstairs in the hospital. Yeah. We transfer a lot of patients, right? So if I had surgery last week for something and they show up to my hospital, best care would be for me to transfer them back to the hospital they got surgery at. That's impossible. And so everything is essentially stuck and not moving, and we continue to get lots and lots of patients.
So what are the main medical problems then that you're seeing? What is, causing this huge overflow?
Yeah, so it's a combination of things. One is people are running out of their medications. So they may have been on the last few days of their high blood pressure medication or their diabetes medication, their insulin for that. And so they miss a few days of that. They get decompensated conditions of those chronic illnesses, and those turn into emergencies, and they need to be admitted to the ICU. We also are seeing a lot of dialysis patients. So normally dialysis patients have kidney failure. They go 3 times a week to dialysis to get the toxins and fluid removed from their body. Because dialysis centers don't have power, they can't do that. And so we're seeing a lot of those patients that are in very, very sick states. Also, lots of patients use oxygen. So if you have lung diseases or certain heart diseases, you're on constant oxygen. Your concentrator needs energy. And so when that power runs out, you have to go to a hospital to get that power for oxygen. And so that's a lot of the common things we're seeing. And then, of course, the heat. We're seeing a lot of heat-related illnesses as well.
I want to broaden this out because many states, not just Texas, but even as far north as New York, they're dealing with extreme heat, which is getting worse, obviously, with global warming. Cities need to really start taking this seriously, finding ways to have more robust responses to extreme heat.
Absolutely, 100%. I've lived in Texas my entire life. I've been a Houstonian, and I'm proud of that. But today, not so much. You and I had a conversation a few years ago when it was a winter power outage. In May, this past May, just 2 months ago, there was a windstorm that knocked out power in Houston for 2 to 3 days for most people. And now we're sitting here again. And so we really need to take a look at, obviously, the bigger picture when it comes to climate change, and then the Texas power grid in particular, which, to be honest, I'm ashamed of currently. And then we need to prepare. And so if you are someone who has chronic medical conditions, making sure you have at least 2 weeks of supplies of all of your medications, making sure that you have a list of all of your medications, the doses, how many times you take them. So if you do run out and you show up to an ER, I can get you your medications as quickly as possible, and there's less guesswork. And then making sure that those of us that have families that are elderly or more vulnerable, making sure that we're checking in on them and that they have the resources that they need and the help that they need.
Yeah, and some cities, Texas, they're talking now about burying the power lines to try and protect some of the energy infrastructure. But in terms of what they should be doing to prepare more to help citizens who are experiencing this extreme heat, what more can they be doing right now?
Yeah, so unfortunately, this is probably going to happen numerous times before we get a final solution. And so, having, for example, cooling centers prepared. We had cooling centers and centers where hospitals could discharge patients to that needed oxygen set up about a day and a half, 2 days into this disaster. These are things that need to be there much, much far in advance. Also, having action plans for folks who are on oxygen, who are on dialysis, so they know exactly what they need to do when natural disaster hits. And then the government needs to help them as well. You know, some of those folks are elderly. They may depend on a public bus or a ride sharing service to get them there. Those are not going to be there in a disaster. And so ensuring that there's a list and a repository of those individuals and they have a way of getting the resources when the disaster hits. And so that's going to require a lot of pre-planning, a lot of resources. It's going to take the government, healthcare, and everyone in between to make sure that when this happens the next time, people aren't dying.
Yeah, a lot more needs to be done because obviously there will be a next time. Dr. Owais, Durrani, thank you so much for being here with us. Appreciate it.
Thank you.